I'd like to introduce you to Dr. Chow. Take it over.
All right, thanks, Jean Marie. Thanks everyone for coming this afternoon, spending a short 30 minutes with me. My talk's about all about your nose, what's causing that stuffy runny nose, and how to fix it. I'm an ENT over at Florida ENT and Allergy. I have two offices, one in Largo, one in Countryside. Just a quick introduction about me, because everyone wants to know a little bit about their presenter. I'm originally from San Francisco, the Bay Area, all the way on the West Coast. Went to the Midwest for college in Minnesota. Carleton College was the name of my college, and then ended up in Virginia for medical school, where I met my wife, who's also a doctor. She's a ER doctor over at Me's Countryside. Then I ended up at UF up in Gainesville, a couple hours from here for residency in ENT. And I have been here. I'm in my first year of practice or so over at Florida ENT and Allergy. I'm a general ENT. What do I treat? I treat basically a hodgepodge of everything here listed: nasal obstruction, allergy, sinus problems, sleep apnea, head and neck cancer, voice and swallow issues, and hearing loss. But the purpose of this talk is to focus on nasal obstruction and allergies. I have no disclosures. I will discuss some devices that I do use frequently in the office, but I have no financial connections with those companies. So quick overview of the talk. We're going to talk about nasal drainage, which can be split up generally into two things: allergic rhinitis or non-allergic rhinitis. I'll go into the specifics of that. Sinusitis or sinus infections does contribute a
Dr.
big
Chow,
component.
I don't think your slides are advancing. We're still seeing what I treat.
Oh, really? How about now?
We're at what I treat. Now in your
Yeah.
introduction.
And then how about disclosures right here?
Now we're disclosures.
And then overview.
Perfect.
Okay. Sorry about that. Technical difficulties. What I was talking about was sinusitis. That can be an entire dedicated talk, but I will not be talking about sinus infections, but that can definitely lead to nasal drainage. We'll also talk about nasal obstruction and how to treat both of these things, nasal drainage and nasal obstruction, either in the office or with surgery. So rhinitis, what is rhinitis? Medical term basically for an inflammatory condition of the nose. We're all familiar with it. It causes significant nasal congestion, nasal obstruction, lots of drainage, sneezing, itchy nose. Like I mentioned previously, it's generally broken up into two categories: allergic or non-allergic. Starting with allergic, you can have either seasonal or non-seasonal allergies. Seasonal, we typically think of trees, grasses, and weeds. Trees tend to grow during the springtime, grasses during the summer, weeds during the fall. Unfortunately for us here in Florida, where it's warm all the time, we probably have exposure to all these pollens year-round. Then you also have non-seasonal allergic rhinitis, also known as perennial allergies. These are mostly allergies at home, like dust, mold, cats, dogs, cockroach, things of that nature. And then the other category is non-allergic. So these can be like food, weather changes, hormonal changes, breathing in certain scents or fumes, perfumes, medications, or idiopathic, meaning we don't even know what causes it. But these are not true allergies. It's just certain people, for example, eat certain type of food and then their nose just starts running like crazy. The way we treat these two things is very different, and that's why I split it up this way. So how do you figure out if you have allergies or not? Well, you can get a good history and physical, but we can also do allergy testing, and there are a number of ways of doing allergy testing. The quick and simple way of doing allergy testing is with a skin prick, as pictured here. It's fast, but it's basically a yes/no answer. It doesn't give you any quantitative information versus intradermals. This is actually using a needle to inject antigen into the skin and seeing how much you swell up. This is the most sensitive type of allergy test, and it does, like I said, give you quantitative data as to how allergic you are to certain things, but it can be time consuming. So there actually is something that we do in our office and most allergy offices called MQT, Modified Quantifiable Test, which combines both a skin prick and intradermal to make it relatively quick, but also sensitive. And I won't get into the details of it, but that's basically the gold standard. There are people who cannot do a skin test, unfortunately. Either like, for example, people with skin conditions like dermatographia, where you scratch the skin and they swell up immediately, uncontrolled asthma. We do have patients who are needle phobic, or pediatric kids. They're scared of needles. The drawback to blood tests, though, in my experience, is that it is much less sensitive compared to the skin prick or the intradermals. But it is something that you can consider. I just like to share a little personal anecdote here. I'm actually an allergy patient myself. You can see this is an allergy test from our group of all the different species of trees, grass, weeds, animals, mold, everything that we test for. I just want to draw your attention to how severely allergic I am, considering that I'm from San Francisco and here in Florida, we're one of the most allergenic states in the country. So I personally am actually on allergy shots, but I'll talk a little bit more about that later. So how do you treat allergies? Three ways that you can approach it. You can either control what you're exposed to, what we call environmental controls, or avoiding whatever you're allergic to. You can take medications, that's what pharmacotherapy means, or even immunotherapy, which are the allergy shots that I'm personally on. Let's talk about each of these things in a little bit more detail. Let's start with avoidance, environmental controls. So we all know, you can use HEPA air filters, you can vacuum your home, laundry, dehumidify your house, potentially try mattress covers, avoid having cats, dogs, pets in the bedroom. But sorry to break the truth, but a lot of studies have looked into this, and there is no significant improvement in quality of life or symptom control. As shown in this graph here, you can see that the orange line is a little bit lower. That's the intervention group with environmental control avoidance, and it's a little bit lower than the control group,
We're
which is the
one
blue
slide
line.
behind you.
Sorry,
That's
technical
okay.
difficulty. How about this?
Yes, we are seeing it now.
Okay, it must be a delay or something. But I was just saying, look at the orange line. That's the environmental avoidance group. It's a little bit lower than the control group, but it's not a statistically significant difference. So you're still probably going to have some symptoms with environmental control and avoidance. So other than living on the moon in space, you're probably going to have some type of allergy symptoms. Let's talk about pharmacotherapy or medications for allergies. The American Academy of Otolaryngology Head and Neck Surgery does recommend nasal sprays as the primary treatment of allergies. Nasal spray is very important. We all know about Flonase, but you can try other nasal steroids like Nasacort or Nasonex. I prescribe them twice a day, and it's important to tell patients that they have to do it at least 4 to 6 weeks every day. It's not like you can spray your nose and you'll feel better within hours or even the next day. It takes time for these steroids to work, but it is the number one best medication used to treat allergies and nasal congestion. I will like to point out another medication that some of you guys might not be familiar with that's very important that I prescribe to all of my allergy patients called Astepro. The medical ingredient is azolastine. This is an antihistamine nasal spray, similar to like a Claritin, but in nasal spray form. The reason why I think this medication is very important and combining it with Flonase, for example, is because of this study, which showed that combining both Flonase and Astelin or Astepro was significantly better than individual treatment of either of those nasal sprays. You can see here the circle graph with the red arrow pointing at the top shows significantly more improvement in nasal symptoms compared to the individual treatments, which are the squares and the triangles. In fact, there even is a medication that you can prescribe to your patients called Dymista, which combines Flonase and Astelin together. But you got to make sure that it's covered by insurance because it can be quite expensive versus just using both nasal sprays separately, which is sometimes what I give to my patients. Quick word on other nasal sprays to be about when you talk to some of your patients is Afrin, also known as oxymetazoline. Unfortunately, there are a number of brands that try and hide the active ingredient by rebranding it as Sinex or Mucinex, but look at these red boxes that I've circled. They all have oxymetazoline. If your patients use this, they will feel amazing in the short term in terms of nasal obstruction and congestion. But if you use it for more than 3 days in a row, you can get rebound congestion, and it's very hard for these patients to come off of these nasal sprays and they feel even more congested. So just in general, don't use it. You can use second generation oral antihistamines. All of us are familiar with Claritin, Allegra, Zyrtec. It doesn't matter which one, you just trial and error if you want. They're all basically the same in terms of controlling allergies. Zyrtec does, though, have a little bit more of a, what we call it, H1 profile, meaning that patients are a little bit more sleepy with the Zyrtec. And then nasal saline irrigation, it's a lot more important than you think. Everyone hates it, but I tell all my patients to do it. You got to rinse out all that pollen that's sitting inside of your nose causing your allergies. The key that I tell my patients is to squeeze the rinse bottle very slowly so that you're not shooting water up into your ears or down your throat. Lastly, immunotherapy, allergy shots or allergy drops. These are very exciting types of technology used to help with allergies. So starting with allergy shots, which is kind of the gold standard, it is covered by most insurances. You can treat more allergies. In our group, we can treat up to 15 allergies at a time. But you do have to come into the office once a week for a shot. As you escalate up with increasing doses of whatever you're allergic to, you're essentially desensitizing your body to what you're allergic to, and it can take up to a year to reach the highest doses of whatever you're allergic to. We call that maintenance. After you reach maintenance, then at least in our group, you can do your shots at home. You don't have to come to the office. Typically, you have to be doing shots, though, for about 3 to 5 years to have permanent changes to your allergy immune system. Of note, if you have a patient or you yourself are on a beta blocker, you unfortunately cannot do allergy shots. And the reason why is because if you did have a reaction to allergy shots, for example, anaphylaxis, we have to use a EpiPen, and a beta blocker can kind of negate the effects of that. The other option is allergy drops. These are drops that you can put directly under your tongue. They can be more expensive because as of this time, they are not FDA approved, but you just administer them at home on a daily basis. They're very safe. There have been no documented cases of anaphylaxis with allergy drops. The downside to it, however, is that you cannot treat molds. Essentially, the reason why is because the mold antigen in these allergy drop vials begins to degrade very quickly versus allergy shots. Okay, we talked a lot about allergic rhinitis. Let's talk about the other subcategory, non-allergic rhinitis. The treatment initially for non-allergic rhinitis is a different nasal spray called Atrovent, and the medical term for that is ipratropium bromide. It comes in two concentrations. I start off here as pictured at 0.03%, but there is a 0.06% nasal spray. I tell patients to use the spray whenever their nose is runny, or if they even know what triggers their runny nose, even better. For example, they eat certain foods like I alluded to earlier. Spray your nose before eating that type of food. See if that dries you up. You can do it up to 4 times a day is what I recommend patients. The beauty of treating non-allergic rhinitis is if you respond well to the Atrovent nasal spray, then there are procedures that you can do in the office that can address the nerve in the back of your nose that is hyperactivated and creating all of those secretions. There are 3 main companies here, Clarifix, Neurant, and Rynair, and they all kind of do the same thing. Essentially, what happens is you put a wand into the back of your nose where the nerve is that produces a lot of mucus, and you ablate it. With Clarifix, they use liquid nitrogen to essentially freeze the nerve. In my experience, patients tolerate this procedure very well, but there have been accounts of people getting a little bit of a ice cream headache. So some patients or providers take 600 milligrams of gabapentin before doing this procedure to prevent that from happening. I have never had that happen in my practice, though. Neurant and Rynair are the other 2 companies. They use something called radio frequency ablation, which is essentially low temperature thermal injury to the nerve in the back of the nose to switch it off. And they just have different head pieces, as you can see here. Neurant has a lot more broader surface area with all of those leaflets versus Rynair is a little small tab at the end of the wand. When I do this procedure in the office, it's very easy. It takes about 30 minutes to do, minimal pain, discomfort. You can return to work the same day. I numb up the nose with topical medication. And then once it sits for about 15 minutes, I go ahead and ablate the back of the nerve with the technologies I mentioned in the previous slide. It's not an immediate effect, though. You have to be patient. It takes about 4 to 6 weeks for your nose to start drying up after this. But the goal is, once you do this procedure, you can use less or even stop the adjuvant nasal sprays. All right, so we talked a lot about nasal drainage. Let's say you've taken care of your allergies with medications, maybe even considered allergy shots and environmental controls, but you're still obstructed. You still can't breathe through your nose. Now we start talking about, is there an anatomic reason why you can't breathe through your nose? There are three main components to nasal obstruction as pictured here, starting on the left. You can have a deviated septum. What is that? So your nose has a party wall right in the middle that is made up of bone and cartilage that divides your nose into a left and right side. It should be a straight line. Sometimes it can be deviated, and in this case, off to the left, and that can narrow one side of the nasal cavity. Another thing that's pictured in the middle is something called turbinate hypertrophy. We all have turbinates inside of our nose. These are swell bodies that help humidify and filter air. However, they can get very large and swollen with allergies. So we can consider shrinking those down as well, either with surgery or in the office. And the last thing I want to mention that oftentimes gets overlooked is nasal valve collapse. As pictured here, what this is essentially cartilage in your lower nostrils that can weaken over time or can be born weak. And whenever you breathe in, that cartilage just collapses, and that can narrow the nostril, reducing airflow in. Here's another schematic to show you what I mean by nasal valve collapse. There is this angle that you have at the top of your nostrils. This is looking from the bottom up. And this angle between your septum and the cartilage of your nose, called the internal nasal valve, should be about 10 to 15 degrees. If it's less than that, people can really start feeling like their nose is obstructed. In fact, up to 50% of air resistance is felt and occurs at this small little angle inside of your nose. So it's small but important area that shouldn't be overlooked. So how do we treat a deviated septum or a large turbinate? Well, with this deviated septum, you can do surgery, something called a septoplasty, where you remove the bone and cartilage that's deviated, as shown in the picture to the left. It is important, though, that we have to keep a portion of your septum called the dorsal and caudal strut intact. Otherwise, you can collapse the nose and you can end up with something similar to like a pig nose. The other option that you can do is shrink down those turbinates, as mentioned before. What you essentially can do is with a endoscope, no cuts on the outside, you make a small incision in the head of the turbinate, and you remove all of that swollen tissue while preserving the overlying mucosa of the turbinate. And that can really shrink things down. Typically, if it's just a turbinate reduction is what we call it, I do that in the office. But if it's a septoplasty plus a turbinate reduction or just a septoplasty, that I typically do in the operating room due to risk of bleeding. But again, if it's just addressing the turbinates, you can easily do that in the office. It takes about 30 minutes as well. And then that last component of nasal obstruction, the nasal valve, well, is a procedure that I do in the office called Vivere or Vivere. And what that does is it uses radio frequency ablation to remodel that cartilage in your nostrils that's weakened and flopping into your nose. As you can see here, you use a wand and you treat 3 different areas, mostly the lateral nasal wall, to help remodel that floppy nasal cartilage shown on the left. You can also shrink down the septal swell body, which is tissue on the septum that can really swell up. And then again, you can address the inferior turbinate with this Vivere wand, similar to a turbinate reduction, but using radio frequency ablation instead. Just like all the procedures I mentioned, everything takes about 30 minutes to do. Mild pain, discomfort, you can return to work the same day. Again, have to be patient though. You will be congested at least 1 to 2 weeks after the procedure due to post-procedural swelling, but then you'll start feeling a lot better with an open nose 4 to 6 weeks later. The last thing I like to mention, as a ENT surgeon, I like doing surgery. I have to talk about spreader grafts. So this is surgery that you can do that's similar to the Vivera technology I just talked about in the office. Remember that nasal valve angle needs to be about 10 to 15 degrees. But what you can do is put cartilage, as shown on the right, at the top of that nasal valve to really open it up. Look at the red arrow on the right side. Look at how narrow that nasal valve angle is. That's less than 10 to 15 degrees. But you can put this piece of cartilage right above it. It's called a spreader graft. I typically take the cartilage either from the septum itself or from the ear, and I make a little pocket, and I gently place this piece of cartilage into this area to widen up that nasal valve. And that's all I got for you. Didn't want to go too much into any details, but here's my cat. Just want to let you all know that, yes, I have severe allergies to cats, but I'm still on the allergy shots and I'm doing great. Feel free to ask any questions. Again, I'm with Florida ENT and Allergy, and my contact information is down below. Thank you for your time.
Thank you so much. That was great. Before we get to the questions, just a couple of broad things. We will PDF this presentation and share these beautiful pictures and information so that you can have them at your fingertips. I will send that out in the post email that we do after the event. We do record these, so this recording will be on our BayCare Present site. That does come in every email I send you. And I put the link into the chat right now for that. I'm going to put my email address in there. If anyone got to this meeting that did not get through one of the emails we got and want to be able to connect with me and be put on the email list, we will do that for you. So what a wealth of information that you shared with us. It was, I have kids and a husband who have gone through all the allergy testing, so I have lived all this. So I loved hearing all of that great information. Some of the questions we have got are, one person, let me read it so I don't mess it up. They get chronic sinus infections, but they've had antibiotics, they've done surgery. Is there any hope? Is there some new stuff out there now that can help people who might be having that chronic problem moving
Yeah,
forward?
that's a great question. Like I mentioned before, my talk wasn't based on chronic sinusitis, but I'm happy to talk more about that because that is a huge component to nasal drainage. The first thing I typically do for someone who's had chronic issues is typically get a CT scan, especially if they had prior surgery done for their sinusitis. The reason why I get a CT scan is to see if they had a good surgery or not. If there's an incomplete surgery where the sinuses haven't been completely open, then considering revision surgery or upfront surgery is important to help open things up. The other thing too is what is causing the chronic sinusitis issues? Is it a allergy problem? Is it a polyp problem? Is it a genetic problem? Addressing the underlying problem is very important. The reason why I say that is because if you have like a chronic sinusitis with polyps, there are actually new types of injections called immunobiologics, something called Dupixent or Nucala, that you can use to shrink down polyps instead of doing surgery. That's one thing to consider. And then the other thing is, doing the medication rinses is very important. I do prescribe my patients a lot of steroid rinses to help with decreasing inflammatory disorder, especially if you've really been on antibiotics a number of times. There are actually some studies that show that if you've been on steroids for more than 2 times in a year, high dose steroids, that can really affect you. Weight gain, messing up your hormones, stuff like that. So I am very judicious with my prescription of steroids when I absolutely need to give it to the patient.
We had another question about allergies changing. Is there any truth in the thought that allergies change every 7 years or are rotating how they affect you?
100%. In fact, allergies can change up to 2 to 3 years at a time. I can't predict it, but if a patient comes into my office, a new patient, they had an allergy test more than 2 or 3 years ago, I repeat allergy test them.
So that seems that someone else asked, as we age, do allergies change and get worse?
Absolutely. Or they can get better. They just change. So typically though, especially in Florida, they get worse.
We're so lucky. Um, We had a question of how invasive probably is the sinus cavity opening? How evasive?
Um, I'm not exactly quite sure of what they're referring to. The sinus
Me
cavity.
either. I'm going to ask him if you can put a little more details about that. I'm not exactly sure about that. So
Maybe he's talking about the Vivere, or she is talking about the Vivere with the radiofrequency ablation to help
mhm.
open up the nose.
Okay. We'll see if they add any more details on that.
Sure.
There's someone's been getting shots for 8 years. Zyrtec
Mhm.
was working, but in May they had a FDA warning to stop doing Zyrtec. Is there any thoughts about that?
I'm not familiar with that, to be honest with you. I'll have to look that up.
Okay. Someone else likes to use the Xclear. They prefer the more natural products. What do you think about some of the natural treatment alternatives?
That's fantastic. I encourage it. I am all for natural products, even though there's less evidence behind that. If it works, it works. Xolair has xylitol. That's the natural product in it that can really help moisturize and keep the mucosa of the sinuses healthy. I do give it to some of my patients who have a what we call low-grade biofilm or like low-grade bacterial colonization. So that is totally fine.
Um, I was wondering if you could talk a little bit more about the flushing of the sinus. I think a lot of people are
Yeah,
confused or a little freaked out about that, maybe. And also there's a very expensive machine you can use. I saw the one that you had in your picture. That's the one my daughter was suggested to use. That one with the next one more slide. You're on the Allegra slide.
this one.
Yep, there we go.
Yeah, no, thank you. That's a really great question. And sorry I breezed over it really quickly, but that is so important. I'm glad you brought that question up. A lot of people are worried about, rinsing bacteria into their brain, for example, or causing an ear infection because the water gets into their ear or they're just choking on it all the time. Um, and like you said, there's a whole market out there that can sell you all these fancy machines that can help you rinse out your nose. But this is very important to do, like I mentioned before, and I like to just keep it simple. Again, no commercial interest with NeilMed, but I really do think they have the best simple type of way of rinsing your nose. It literally is a plastic squeeze bottle that you put some distilled water in it with a salt packet. You can pack up 100 salt packets separately for a few bucks on Amazon or your local drugstore, and then you put that into your nose. And like I said before, you have to gently squeeze the bottle to start filling up your sinuses. Similar, I use the analogy with my patients about filling up a bathtub very slowly, because that allows you to rinse out your sinuses and allow the water to come out the other side without shooting straight into your throat or straight through the eustachian tube into the ear, which can cause patients a lot of discomfort. But the whole point is, if you have allergies and you're breathing in, for example, all this pollen or cat dander, that's sitting in your nose and causing the allergic reaction. Yes, you can use Flonase, Astelin, antihistamines to help dampen your immune response. But if you mechanically rinse that stuff out of your nose with a rinse bottle, that's going to make you feel 100% better.
And the distilled water is important. And if you just go to your grocery store or whatever, just look for them. They are with the waters, but it does say distilled water. So it's you want to make
Correct.
sure you
Distilled
grab that.
water. You can even use bottled water. I typically don't recommend tap water, at least in this area, because there are a lot of calcium deposits built into the water here in Florida. I definitely do not recommend well water. And I alluded to, like, rinsing bacteria into your sinuses or into your brain. That is a false myth. It's hard sometimes to convince my patients about that sometimes, but that is not true as long as you use, clean distilled water.
Going back to that question we were confused about a little earlier, the question is they were told that their sinus openings were not large enough and they needed to have the openings enlarged to the sinuses. What is your thoughts on that?
Okay, now I understand. That's a great question. That can be an entire lectureship series on that. So probably referring to chronic sinusitis, where the openings to the sinuses are very small. You can address that in the office with something that's quite popular in our field in the ENT called balloon sinuplasty, or you can go to surgery and surgically open those sinus openings. Balloon sinuplasty is done a lot in our office. However, in my opinion, I do think it is over abused. I think it's because of reimbursement is very good within our field for doing these procedures. But there is a place for that. I would say people who have a CT scan that show no polyps, um, and have relatively mild, maybe even moderate sinus disease is reasonable to offer a in-office balloon sinuplasty. Basically numb up the nose, put a balloon into the sinus opening, inflate it for about a couple of seconds, deflate the balloon and pull it out of the nose. And you can address that for all 6 sinuses that you have. The recovery is a lot easier for that type of procedure. However, you're not making the openings to your sinuses as large as you would with surgery. I offer surgery, or I encourage patients to consider surgery if they do have CT evidence of heavy sinus disease, nasal polyps, or very thick bone that a balloon isn't going to be able to crack open.
Okay. You mentioned using like Astropro and Flonase together. Can you do them at the same time, or do you want to like wait a little while? What's your thoughts there?
There you go. You can do them at the same time. Doesn't matter. You do Flonase, one spray into each nostril, followed by the Astropro, or vice versa. They're 2 separate bottles. Or you can use the Dimisto, just one spray into each nostril twice a day.
Is the Atrovent an over-the-counter medication, or is that a prescription?
It is a prescription. There it is.
Okay.
Yep.
So they would need to talk to you or their provider to get that prescription.
Yep, that's right. That's a great question. Yeah, it's everything. All those other medications I mentioned are over the counter, but Atrovent is unfortunately still a prescription. One thing I did want to comment on is it can over dry your nose. So that's why I start at 0.03% and only use it when you have a runny nose. Do not use it if you are not symptomatic.
What are your thoughts on those simply saline mists where you just kind of squirt a little salt water up your nose?
That can help with drying out your nose, or that can help out with dry nose, and scabbing or even nosebleeds. But in terms of rinsing out your nose from all the pollen or the cat dander, dog dander, whatever, you really need to have high volume nasal saline irrigation with the Neomed or any type of rinse bottle that you have.
I use it when I go up north because I tend to get nosebleeds in the wintertime, so I keep my sinuses moist.
Yeah, no, me too. Whenever I go to Colorado, just a simple saline spray just to keep the nose more moisturized helps me significantly.
Is there any scientific background behind adding a little bit of colloidal silver to those sinus rinses?
Good question. I'll be honest, I do not know. I presume the idea is if you have silver, it is antibacterial, like we have silver in Band-Aids, but I have not seen any literature or research mixing that into saline rinses.
When you're sleeping, does it matter which side you lay on to affect your sinuses and nose congestion?
Oh, that's a really good question. So there's something called the nasal cycle that we all have. Basically, it's gravity-dependent vasodilation of your nose. So if you sleep on one side, the more gravity-dependent side. So for example, you sleep on your right side, the right side of your nose will naturally get more congested because more blood flow is going to those turbinates. Remember those swell bodies? Let's see if I can show you a picture. Middle picture right there. Those swell bodies get more engorged with blood flow on the more gravity dependent side. So when you switch over to the left side, then all the blood then goes over to the other side. So we call it the nasal cycle, and it can switch back and forth.
Oh, very interesting. Does it matter what time of day you take your medication? If taking Zyrtec at night, or does anything, I know Zyrtec made you sleep a little bit more. Is there any benefits of taking them different times of the day?
Yeah, I think it kind of you have to listen to your body. I think we're probably most exposed to allergies during the daytime. So if you take the allergy pill in the morning time to allow it to work throughout the day, that'd be fantastic. But like you had mentioned, there is a possibility of being a little bit sleepy or more drowsy, especially with the Zyrtec. So just listen to your body. It doesn't really matter though. You can take it any time of the day.
So you talked about the time frame for repair. We talked about that enlarging of the nasal cavities. Is that a similar time frame? You're going to be swollen for a few weeks, and then it takes like 4 to 6 weeks to help with that. If I was going to expand my nasal cavities or the openings.
If you're talking about the in-office balloon dilation that I didn't show here in this slide deck, um, It kind of depends. I'm hedging a little bit. I typically have patients come back and see me in a week for debridement, another 3 weeks for a repeat debridement, and by 3 months they're probably back to normal for the in-office balloon dilation. If you're talking about the Vivere procedure, as I have pictured here, that's about 4 to 6 weeks. So it's a little bit longer for the balloon sinus dilation.
All right, we have another question about a nasal spray, Xlear, Xlear. Are you aware of that, and do you like that?
Yeah, I like Xlear a lot too. That's totally reasonable too. To use. It's just not as much evidence behind the other nasal sprays that I presented earlier.
And then we have a question about like, how difficult is it to correct or remove scar tissue from an injury like a fall? So I guess associated with the nasal cavity and the nose.
That's a good question. It kind of depends on where the scar tissue is. For example, if you break your nose, you can either have a septal fracture or you can break your nasal bones. Typically, we want to fix that within 10 to 14 days before the bone callus is over. If you're talking about scar tissue within the nasal cavity, we call it synechiae. That can always be lysed or removed at any time, usually in the office. So it kind of just depends on where the scar is within the nose and the timing and how hard it is to remove.
All right, I'm going to ask you to go to your very last slide again. I want to thank everyone for being here. And Dr. Chow, so thank you so much. It was a very informative talk. I believe you have offices all over the area. Where are you specifically located?
Yeah, I am located in Countryside by Mace Countryside Hospital and also Largo, right by Largo Medical Center. My group, Florida ENT and Allergy, though, does have about 10, 15 offices throughout the Tampa Bay area.
We want to thank everyone for being here today, and thank you so much for sharing a wealth of knowledge. I think maybe we'll chat offline and bring you back in for another chat on some other topics. I think you've got a wealth of knowledge that we can tap into. And I want to thank you all, and we'll hope to see you again next month. When we send out the follow-up, there'll be the link for our next talk also. But have a fabulous day, everyone, and make sure you take care of your sinuses.
Thanks, everyone.